Hey guys over in Facebook, welcome. Everyone on Instagram, welcome. Just checking that everything is all doing okay right now. Awesome. Okay. So, hey guys, welcome to the CPD Junkie podcast, hashtag a lockdown special, where every night at 8 p.m. we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who have already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of this site. I'm your host, Dr. Laurence Doan, and tonight we are joined by Dr. Ricky Lim. Dr. Ricky Lim was born in Korea, grew up in Auckland before moving to Sydney. He then studied dentistry at JCU in Cairns before embarking on his dental career in Sydney. He has a friendly and warm approach to his patients, and it has helped him develop a reputation as an excellent dentist. Ricky has strong interests in all fields of dentistry, but has been taking further trainings in composite resin, porcelain crowns, veneers, and oral surgery, including wisdom teeth removals and dental implants, by some of the world-renowned dentists and specialists. Ricky never stops learning by attending continued professional development courses, frequently to stay up to date on the latest dental technology and techniques. Ricky likes to spend time with his family and friends on the weekends. He's picking up photography as a hobby and also likes to play racket sports and snowboarding. Dr. Ricky Lim, welcome to the show. Dr. Ricky Lim, welcome to the show.
Hello, thanks for having me.
So you mentioned you have a special interest in restorative dentistry, prosthodontics, and oral surgery. Tell us all about your CPD journey so far and what you've been getting up to this year.
So I've been working for about 4.5 years. I think I started my CPD journey with learning about, dental photography. I think I went to my first major course was probably with Dentistry. He's a dentist from Switzerland with a huge restorative background. Went with a bunch of friends. It was more of a bit of a holiday in Brisbane, but it turned out to be a massive CPD. I learned so much from it, and I think just a fairly early exposure to really good CPD sparked my interest in restorative dentistry. And following that, I did some courses on occlusion. Because I was seeing a lot of tooth wear cases that I wanted to plan well and execute well. And I did the mini residency in fixed prosthodontics by Tony Rotondo and Michael Mendicos. That was a really good course. Did some implant courses as well.
Well, let me help you out here. So you mentioned Didier Dici. Not a lot of recent graduates probably know who that person is. I mean, he's a pretty well-renowned dentist. How did you come across him and deciding to go and doing this course? Because I'm sure that course wasn't cheap either for a new grad.
Didier Dici. I don't know how I found out about him, but I don't know, probably would have been on Facebook or something. There's so much information on Facebook, and being a dental student, I was probably DPR was a platform where I saw really amazing dentistry and really inspired me, and must have come across I don't know if you know Maxim Belograd. He learned from Didi Ditchy as well. I think I just, heard
One thing
about
led
it.
to another, and then that's how you found out
Yeah,
about the
yeah,
course,
yeah.
and that's how you ended up there.
And then yeah. One of my friends said, "Oh, he's coming to Australia. Let's go. Let's have a CPD. Yeah, let's do a CPD. Yeah."
Then you mentioned the occlusion. You mentioned about the MIDI residency. Tell us a little bit about that and how you found it.
Oh, just really good. I think not saying that doing direct restoration such as class 2 is simple, but if you're doing something like dental implants, or if you're doing if you're changing someone's occlusion by increasing the vertical dimension, I think you really need to have a good fundamental knowledge. And to be honest, I don't think I graduated dentistry knowing too much about it. So again, Facebook, it's a great platform to get recommendations for courses, and went to Tom Giblin's occlusion course. I think it's called like occlusion basics or fundamentals in occlusion.
Mm-hmm.
So I did that, and yeah, it was fantastic, really hands-on. Mini residency, it was mostly lectures, no hands-on. I probably went in thinking, again, my friend recommended. I'll just be like, yeah, sure, let's go. And I wasn't looking for hands-on course, so it was great. It just picked a couple of important topics in prosthodontic specialty, and those really well-known specialists, Tony Rotondo and Michael Mandikos, just gave you a summary lecture on some of those key topics, and it was great. Yeah.
Sure. Some of what, most people that follow you on Instagram probably notice your wax up game is phenomenal. And I mean, I don't know many dentists who spend as much time doing their wax ups themselves as much as yourself. How did you learn that attention to detail?
Don't think my wax up is has that much attention to detail, but I think probably came from watching my technicians. I think I learned a lot from them. I mean, I've only been working for 4.5 years, so I haven't, I think all relationships take time. So can't say, I've had a long time to build relationships with them, but if you spend the time communicating with them, then they'll be more than happy for you to come over, and you can watch them do the work. And I think wax up really helped me understand the morphology. So when you do a good wax up and you feel it with your fingers, you get a 3-dimensional understanding of a tooth. And I think that's probably as important as taking good photos and looking at good nicely photographed teeth. So I don't know, I think I was just still passionate about it. Yeah.
Did you work on many bars of soap?
No, never. I haven't done any of it. And I probably did the wax up with the intention of, I'm still very analog. I don't do digital wax ups, but I send a case to a technician. Sometimes it comes back and there's a couple of things that I want to change. Maybe I might not notice it when I get it back immediately, but when I do try it in the patient's mouth and there's certain things that I need to change, if I can change it without sending back to the technician, then chances that patient can try it in the mouth sooner. Or sometimes maybe a better way is, if you know how to do wax ups well, then you can probably skip a couple of steps and do some form of mock-up directly in the mouth with composite resin. But I think it all came from similar idea that I want to be able to modify some of the work that comes from the technician. So
fair enough. Yeah. To customize it and make it yourself, and then tailor it for the patient, being able to not just taking the work and then transferring, but also being able to adjust it for the patient in chair that you're talking about.
Yeah.
So, on your Instagram, you've recently become a master guide clinician in 2020. Tell us a little bit about that.
That needs to be edited. It's been postponed, since COVID. So it was supposed to resume this year, but the current lockdown postponed it again. So who knows when it's going to finish. So that's a really good course. I have been enjoying it. There's 4 modules. It's a 1-year-long implant residency kind of program.
2 years in your case, hey?
But yeah, a couple of years in my case. I've done about 2 modules so far, and it's been great.
Cool. Can you tell us a little bit more about it? Like what made you pick it, and what are you getting out of it?
So when I started it, they didn't have other implant programs in Australia. So I know that in Melbourne they have ARIA. In Sydney they have is it AIA? There's a couple now, but back in 2019 they only had Guide. So maybe not only Guide, but Guide was one of the more mature programs. And I don't know, when I did the program, quite a lot of people told me that it's for those that have placed, like 50 implants or 100 implants, or have some form of experience, but I didn't have that. But I still thought, it's probably true to say that if you have some experience, then you'll get more out of a specific CPD. But, I thought, I'll probably get something out of it regardless.
Yeah, so I guess what you're trying to say is like, yes, it may be a little bit more intermediate to slash advanced, but what you're saying is that, you got to start somewhere, and, a program such as this that's been well represented is a good platform to get to. And that's not to say that, I'm thinking, your implant is education is going to stop there. You're planning on building it on it in future and doing more implant courses, I assume.
Yeah, I was happy to spend the money. So yeah.
All good. So, we've mentioned a few CPDs, but, of all those CPDs, and amongst any other ones that we haven't mentioned, what's had the biggest clinical impact on your dentistry today?
No, it's hard to say. I think Didier Ditchy's composite hands-on course was really good. Mini residency in fixed prosthodontics that really was great for me. Michael Mendicos, Tony Rotondo, great educators, great background. They can, they're so experienced, they can answer any questions, right? They're so humble too. So it was a huge what's the word? Not necessarily a wake-up call, but it really made me realize that it's important to have these professional attributes as well. Not just doing good work, but just being really nice as well. So I think mini residency, I'd have to choose that because it was the most comprehensive CPD that I've done. Even though it didn't have much hands-on, but it also taught me to, slow down. Because originally when I read the pamphlet, I thought, when I do this course, I should be able to do, full mouth rehabs without much hesitations or without much hurdles. But what it actually taught me is that it's important to break it down, take it slow, do proper diagnosis, treatment planning well.
So I guess you kind of dabbled there. So who would you say has been your biggest kind of mentors and idols in your career path, and why? I think you kind of mentioned a few names.
I think mean, Tony Rotondo, he's fantastic guy. So he'll, I've met up with him a few times. He's a super nice guy too. Some of the technicians that I've seen, Terry, the one that I work with more and more these days, he's taught me things that, I can't learn at CPD. And his good friend, Ricky Lim, he's a really, fantastic technician. He's taught me a few things on implant prosthetics, just because, he's so generous with his time, Sabi, probably like 3 years ago, I just messaged him on Facebook because I had all these burning questions, and he was so nice that he bothered to reply, and that message probably went for 6 to 9 months answering questions. So all those guys have had huge impact, I think.
Awesome. Yeah, definitely. I've had a chance to meet Ricky before, and I've messaged Sabi a few times. Definitely very open and with communications and everything. So what may not, many people who follow you may not have known about any particular struggles you might have experienced during your CPD or dental journey so far. Have there been any particular struggles?
I think struggles came with surgery, and I think struggles came with doing bigger rehab cases, because for me, I work in a clinical setting where I don't have someone that can bail me out, right? So, and I don't think that's necessarily a bad thing for me. Just been doing CPDs to chase after mentors and learn things. And you look at some posts on Instagram or Facebook or even YouTube, and you think this particular procedure is not that difficult, and you try it, and it's much more difficult. And there's things that you have to. Those tips and tricks you only know from experience, and a lot of it is very difficult to get out of if you're doing something that's, if you're doing surgical procedures. So I guess the most difficult one was one of my earlier awful wisdom teeth cases. Lucky that it was on my best friend. Took like 2 hours. It was a big, buff guy, but I think that was a great learning curve, and got them all out eventually, but it was a long appointment, and I think my confidence level dropped down, and maybe after half dozen cases, my confidence level went up slowly again. And then, placing implants, your first 10, 20, it's very, very difficult, So I think those surgical dentistry has been, it's been very enjoyable. It's what I look forward to, but again, it's been the struggles.
Mm-hmm. Yeah. I guess you got to come out of your comfort zone a little bit more each time to kind of make that progression, right? You can't always be boxed in that comfort zone, especially when we're this early in it. But it's good to know, when you need help and you reach out to other people. And for a lot of people, new grads in particular, they kind of get boxed in, and they might not have that mentor. They don't realize they need to go and reach out to other people. And I think what you did that, and that's what's kind of helped you move forward.
For sure.
So what does your current ideal clinical day look like? The type of procedures you might be getting up to?
On Fridays, I like to do wisdom teeth and implants. I don't know. I like to do a bit of everything except for seeing children. And, I used to love endo. I wanted to get into endo specialty when I first graduated, but it's probably something that I don't look forward to now. So, I think I prefer to maybe do some reviews in the morning, maybe consults before lunch. In between, maybe I'll do some restorative procedures, whether it's a crown or you know, some fillings. I love doing fillings. And then in the afternoon, maybe like early afternoon, I'll prefer to do some sort of surgery. Yeah, I think.
Fair enough. Fair enough. I mean, you're not the only one that's mentioned, you know, endodontics has been something that they're passionate about when they're graduating. Even previous guest of ours, Jonathan Michael, also said the same thing, that they were passionate about endodontics before they came out. And would you say that was because of, you know, some of the tutors you had back at uni that was kind of that kind of inspired you, or you felt like, was there a particular reason why you felt like endodontics was the thing and then that kind of changed?
I can say that didn't get much mentorship or tutor experience at JCU with endo, but what I can say is that I think I was pretty lucky with first few cases in private practice. You know, in retrospect, I don't think they were very complex, but, you know, first couple of upper 6 cases that's gone well, you think you're a hero, and you think, oh, maybe, you know, I'm
you have a knack for it.
maybe, and I even went in to observe a couple of endodontists, and but what happened at a similar time is my interest in surgery and pros grew at a faster rate. So in comparison, the passion in endo kind of went away.
Yeah. Okay. So it was kind of like a slow transition. It wasn't that you were no longer interested in it. You were just growing more interested in another aspect of dentistry.
I think,
so share with us what you hope your ideal clinical or non-clinical day could look like in 5 years' time, and, you know, what kind of CPT that you might be interested in getting into to kind of get you to that point.
I think so in 5 years' time, you said clinical day and non-clinical day. I think clinically, I might want to start narrowing down my what do you call it? Spectrum? No, not spectrum. Like I think I want to focus more on, you know, restorative and surgical work, because I'm still seeing some kids, and I don't know, I feel bad for them because I don't know how to talk to kids. I started doing some, you know, soft tissue surgery, connective tissues and free gingival grafts, and it's fun. I really like doing it, so I want to, but I haven't done any CPDs on it, so I really want to do it. Last year I was supposed to travel overseas and get some sort of holiday out of it whilst learning, but it all got cancelled. So yeah, perhaps in a couple of years I want to do those CPDs. 5 years time, non-clinical day, might be a dad, so I have to spend time with the kid.
You're dropping bombs here now, hey?
5 years, I'll be 34, so yeah.
Still young. So let's backtrack a few things here. Hey, so you've mentioned that, you know, kids aren't particularly you know, what you want to dabble in dentistry. I don't think, I guess, a lot of new grads have to feel like they have to do, you know, enjoy all aspects of dentistry. I think, you know, it's fine to kind of narrow it down into those particular things that you like. I mean, dentistry is a long journey, isn't it? So you kind of want to spend more time on those things that you enjoy. So I don't think it's bad that you don't like kids. It just wasn't for you. Some of the things you also mentioned was, you know, particular courses overseas. Was there any particular course in particular that you were talking about?
Oh, I really wanted to do Ricardo Cairns soft tissue course. It was in Brazil. I was gonna travel by myself and do some solo traveling after, but yeah, it never happened.
Fair enough. So has there been any particular CPD that you felt that you didn't quite implement or wasn't as beneficial for you at the time and you would do differently next time?
Well, the only thing that I can think of is, I don't know if you know, but my first ever CPD was Young Dentist Conference. And I put my name down in this raffle and I won a free course to, what's that aligner company? It's green.
Invisalign.
Not Invisalign.
Clear Correct.
Clear Correct, yeah. So I went to that for free and I had zero interest in it. And I fell asleep in the whole thing, and the orthodontist, I think he works in Blacktown. He saw me, fall asleep numerous times. I felt so bad, but I couldn't help it because the night before I had something important on. And yeah, still, like, to this day, I don't have a huge passion in ortho. In fact, I don't know much about it, but I do know that it's very important to offer to patients. I always do. But yeah, I mean, I do a little bit of Invisalign, but as a pre-restorative.
Yeah.
But just yeah, pretty.
I mean, do you think you had to do it to realize you didn't want to do orthodontics, or do you feel like you already knew beforehand that you had no interest in orthodontics, but you got it, and so you might as well just attend it and see?
I think everyone's a bit different, but for me, I probably don't have much capacity to be good at, I mean, to be an all-rounder. So yeah, at the moment, I feel like I don't have much room to fit something else.
Yeah.
Yeah.
Now, fair enough. Maybe the orthodontist might need to give you a double shot of coffee next time to get your attention, hey? Triple shot, just to make sure you're lasting all the way through.
I can do triple shots.
Yeah. Okay, so Dr. Ricky Lim, thank you so much for coming on the show today. If you could let the people know where they can find you or what's kind of going on in your life, outside of COVID.
What was the last part?
Anything that's kind of going on in your life at the moment.
Anything? Well, I'm in lockdown, mate. Nothing exciting, to be honest. Yeah, sad ending.
Yeah, I know. We just got the news in New South Wales is going to be locked down for another 4 weeks. So unfortunately, it is going to be a little bit of a long stretch.
Yeah, I mean, when this lockdown's over, keen to go to a pub, keen to go to restaurants. It'll be nice.
Let your hair down a little bit. So let them know how they can find you.
Not very present on social media, but I do have an Instagram account. It's Dr. Ricky Lim. You can find me there.
All right. Thank you so much. So all of the viewers on Facebook and Instagram tonight, thank you so much for tuning in. We'll be back again tomorrow with 2 representatives from the Sydney University Dental Student Association, SUDA. So tune in then. But for everyone else, thank you and good night.
Thanks for having me. See ya.